on the skin, in which case we will just a little bit. I'll drape properly, and the main reason why would be so I could do my skin rolling technique. So when you start a Tuina massage or Chinese massage, you have to make the decision at the beginning whether or not you're going to do the entire massage exclusively over top of sheets, or if at any point in time you're going to want to work directly on the skin. And again, with working on the skin, the only two techniques you really need to is going to be skin rolling and with our scrubbing technique to create friction. So because those are our only two techniques, I'm going to do the majority of this treatment over top of the sheets. So with the inspection process or the assessment process, we would have already done our range of motion, but now we want to do our basic palpation. And typically, when you're doing your palpation of the back and spine, you do the entire back and spine. So you'd start up at the neck, and you do your Jing Bai Lao and Ding Chuan, and you do GP21, GP20, right, all into the neck. But for the sake of brevity, we're going to keep it just within the low back region, all right? So starting out, and this is part of the session, so you would build it into the massage. We begin by palpating along the due meridian. So you can palpate either with an individual finger, or you could use reinforced thumbs. I didn't bring my tools today, but you could just as easily use a tool. So if at any point in time you feel any pain or discomfort, let me know, okay? So I'm reinforcing my thumbs, remember, back to back with my thumbs. So I don't want them like this. It's the nails back to back. You go down the due meridian. And then once you hit L5, move up and do Jiaji. So just beside my idea, right? And what I want you to notice as I do this is my arms are staying in the exact same position, right? I'm not bending my arms and extending my arms. My elbows are locked, my shoulders are relaxed, and the entire pressure is coming from my core, my waist. Then we get down into the sacrum, back up to the first UB line. It's 1.5 sun line. And the same thing, palpating down. Now this process should take you about 5 minutes. And that's starting from the neck, going all the way down. And then we'll go to that second urinary bladder line and the 3 sun line. Now, I've done a little bit of low back palpating. I'm also going to be working the hips. So with the hips, we'll mostly go on that second urinary bladder line. Palpate down, same thing. If there's any pain or sensation, you let me know, yeah? Yeah. I want you to notice how my hands are, my knuckles are curled in. Because what you can do in the back, curled in like this. What you can do in the back, say, is you can have your fingers like that to create strong support. I'm certainly not going to be doing that while working on the glutes. So, nice loose fist, and I'll work down that second urinary bladder line. Alright, find GB30. So, palm to the sacrum. We're not being super specific here, right? We don't need to get out our measuring tape or anything like that. Greater trochanter, lateral third, and I'll press on there. Now, when I press on GB30, when I palpate, I'm going to move my hands back and forth, because while I don't want to be specific on the point, I do want to be specific on the muscle, and I want to assure that I'm actually on the piriformis. How's that? A little sore, okay. And then we move down into the legs. So that's going to be UB 36, 37, 40, and 57. Moving down the leg gradually. So I'll just use the tips of my fingers in this case. Same thing, you could use your thumbs, but I'll just use the tips of my fingers. And instead of just jumping to the next point, UB 37, I'm going to move to UB 37. How's that one?
A little sore.
A little sore, yeah. 40. Now with 40, when we palpate it, you know how to find UB40, right? It's the middle of the popliteal crease in between the tendons of semitendinosus and the membranosus on the medial side, and then biceps femoris on the lateral side. So it's right in between those two tendons in the center of the popliteal crease. But when we palpate, we're actually going to move down about half a sun, about half a thumb. I'll palpate there. How's that? Yeah, that one's 10. And then going down.
So why down?
Why just a little bit down?
Yeah.
If you press directly in the center of the popliteal crease, it hurts on virtually everybody. But if we move down a little bit, then we're actually on the belly of the popliteus muscle, and that's more accurately going to give us a sign of dysfunction within the knee.
But it still means that we walk on UP40.
You got it. Yeah, and because if we do press right on it, and everybody says ow, it doesn't tell us if there's dysfunction, because it just hurts on everybody. But if we move just a little bit inferior, then it's more accurate of dysfunction. 57. Palpate fairly easily. It's going to be in between the two bellies of the gastroc as I move down. If you're having a hard time finding it, can you point your toes for me? Good. Just point your toes, and I feel those two bellies, and I'll just palpate there. Not bad there?
Sore.
Sore. Okay. All right, easy enough. So you'll start with your palpation, and it is part of the massage, so I don't want you poking. All right, we're palpating, so you're using a broad contact surface, and all the while, you're keeping in your mind, I don't necessarily want this part to feel good, but I certainly don't want it to feel bad. So you're being mindful of what it feels like, okay? All right, now we're going to get into the actual treatment. So we start with our superficial techniques, which is going to be largely our pushing. So I can stand on one side of the table, and I can push up towards the top. I'm going to push down towards the bottom with my hand over top of the sheet, so I get a nice glide. If you're working over the skin, you'll find this technique a little bit more difficult. A contact surface I use very regularly on the back, well in fact everywhere, it's going to be the back of my hand. You want to make sure you're not putting too much pressure into your wrist, so I am going quite light. The main reason I use the back of my hand is if I use the palm of my hand, sometimes it sticks, right? So I could just use the back of my hand. I can also use my forearm. Now another thing that we can do if you're finding the sheets are sticking, can you bring your arms to the side of the table, just right like that, and bring them down right there. Good. So hanging over the side of the table, we can take the sheets, we can tuck the sheets underneath the shoulders, and that will make sure the sheets stay in place when we're doing our pushing techniques. They're a little bit more secured, right? So that's working on one side, or I can stand at the top of the table and I can work both sides simultaneously, but if you're going to do so, you want to make sure that you've got enough reach. Now what I want you to notice as I get down towards the glutes, I'm extending my wrists, my fingers are off. I'm not going to be sliding into the glutes yet. That's going to be a separate technique. Easy enough, right? You're either standing at the side of the table, working up, or working down, or standing at the head of the table and working down on both sides. I don't want to see you doing this, working bilaterally up. Look at how my body posture is. I'm leaning way over the table. You're going to cause yourself back pain. So be mindful of your mechanics. All right, so that's our superficial technique. We're now going to be shifting into some deeper techniques. With deeper techniques, I usually move into kneading. So with kneading, focusing largely on the low back, I could stand on this side of the table and I'll just use the pads of my fingers. Just starting to knead. Now, once I get into kneading, I'm really beginning to use palpation again. I'm starting to feel what's going on, and I felt quite a bit of tension up here. That's right around the TL junction, right around UB20-ish. UB23 is kind of tight too. Once I reach the sacrum and then move up, I can go to that third or the second UB line, the 3-cin line. I can also work on the opposite side of the table, right? Because I'm not leaning over. If you find yourself leaning over, don't work on the opposite side of the table. You can use the palm of your hand as well for this kneading technique. Now, the way that we separate the low back from the hips and the low leg is we can conceptualize it as I'm going to do my introductory techniques here, and then my introductory techniques here, and then here. So I'll push, knead, press, push, knead, press, push, knead, press. Or we can do our pushing techniques, and then we can move into the glutes on the gallbladder meridian and do our pushing techniques here. Notice I switched to using the back of my hand. Again, it's just easier to glide along the sheets when I'm using the back of my hand. Or I can push down this way. I can use my arm just as well, right? So you're getting the idea. It's pretty simple. Now, I'm not going to spend a lot of time working down the hamstrings, because with the hamstrings, these are more of our distal points and our adjacent points. The further away you get from the affected area, the less time you really need to spend. So by the time I get down to the calf, I'm really only going to spend a minute or two when I actually do my pressing and suppressing techniques here. So you get the idea how we can either do 1 region, 2 region, 3 region, or we can do the whole section at the same time. And it really is up to you what you prefer. All right, so we move into kneading. Now kneading on the glutes, I'm always going to use a nice loose fist. We can use our index fingers, and I'll show you how, but I prefer with our introductory kneading to use a nice loose fist. You can use one fist and just... what you'll notice about this position is my arm is locked, and I'm essentially just rotating my wrist in circumduction. So I choose one spot, and I just rotate in circumduction. And I'll pick another spot and go in circumduction of my wrist. Make sense? Mm-hmm. Now, if you choose to use your fingers, the tips of your fingers, you'll ask permission for it first, of course, before we work on the glutes at any point in time. And I'll just reinforce one hand, and I'll start to do little circles. Now, the reason I prefer not to use the tips of my fingers at this stage is I haven't done enough warm-up techniques to get, I haven't done enough warm-up techniques, which means there's a higher probability with using my fingertips that I'm going to cause a twitch or uncomfortable sensation or pain. So go ahead and use them. Just be mindful of your pressure. All right, makes sense? Now, as always, these demonstrations are relatively quick because you don't need to see me sit here for 5 minutes and slowly knead the back. You will knead the back for 5 minutes, but you don't need to watch me do that once you get the phone. Any questions about that up to now? Now we're going to shift into our deeper techniques. All of that was superficial, kind of introductory techniques. So as we move into our deeper techniques, the first one that I always use is rolling. Remember, rolling is going to be between a mild and moderate amount of pressure. It will never be deep. Kneading is mild amount of pressure. Pushing is mild amount of pressure. So that's between, say, 1 and 3 on the sensation scale. Moderate is then going to be between 4 and, say, about 6. And then we're going to have a strong amount of pressure, which is 7 or 8. So now we're going to move into rolling, which is from 1 to about 6. So I can start with my left hand or my right hand. Remember, you need to be able to do this comfortably on both. So I'm going to roll low back, glutes, legs. So I'll start with my left hand, beginning with my little knuckle anchored on the spot I want to work on. Get myself into a nice little horse stance. Your elbow can be either parallel with your wrist or just above. You don't want it fully extended, and you don't want it below, right? So nice strong horse stance. And then I just start to roll. Now, when we're rolling, ideally, you keep a consistent roll. So you'll notice how I shifted my body mechanics without stopping. But if you're finding it's hard to shift your body mechanics without stopping, no problem. Stop, shift, and keep going. So, see, I've got all my weight leaning on my left leg, which means as I move down the back, I can just roll. I forgot to take my ring off. As I roll down the low back, I could shift my weight to my right leg. So we can either move our stance or just shift our weight from one leg to the other. Is that making sense? Mm-hmm. Now with rolling, this can take 5-10 minutes, right? Because we are very gradually increasing the pressure. So what you'll notice is right now, it's not very strong pressure, right? But if I just stand up a little bit more, I can increase the pressure quite significantly. Is that feeling much stronger?
Yep.
Yeah. Now, by the time you increase the pressure significantly, you're going to notice it's harder on your body, of course, because you're using more pressure. But the question is always, where is the pressure coming from? Core. So how does that work then if I'm increasing the pressure with my core? This is where the technique gets a bit complicated. In the beginning, I say just rest your hand and roll. It's just the weight of your hand and arm. Everything's nice and relaxed. But as we increase pressure, now I have to stabilize my shoulder, stabilize my elbow, and push in with my core, right? So if you see the movement, arms like this, now I push with my core. So I lean forward like that. But this is still staying in that static position. As opposed to standing here and pushing with my arm. Making sense? So pushing with my arm versus pushing with my core. So I'll get into the position I need to be in, I'll lock my joints, I'll push in with my core, and then I can do deeper rolling. All right, getting into the glutes. Now, as far as the gallbladder meridian on the glutes is concerned, we can either work from the trochanter towards the sacrum or the other way around. So from the trochanter to the sacrum, start in this position and I roll towards the sacrum, or I can go from the sacrum towards the trochanter. Now you'll notice that when it comes to the hand that you use on the back, you can use both hands, right? Left, right. When it comes to the glutes, standing on the left side of the table, I can only use my right hand. Or standing on the right hand of the table, I can only use my left hand. So some regions of the body, depending on the side of the table, determine which hand you use. And then in the lower body, or sorry, in the legs, it's the same idea. We can just roll down those legs, gradually increasing the pressure. So far, so good. All right. Now, move into deeper techniques yet. We're going to move into pressing and suppressing. Remember, with pressing and suppressing, we can do them back to back. What I mean by that is I can pick a point. Maybe it's going to be UB23. So I find UB23. I pick a point and I can press. Pressing is broad contact surface. We're looking at a moderate amount of sensation. So somewhere between, a 4 to 6 amount of sensation. I can use my fingertips. Broad contact surface still. Use my elbow, right? So I can press and then immediately go into suppressing. So I can pick one point, press, suppress, press, suppress. Or I could do pressing on my main points. That's going to be, say in this case, UB20, GB30, UB37, 36, 37, 40, 57. Those would be the main points I choose. Maybe I pick a UB point on the glutes as well, right? So I can do pressing on all of those and then go back and do suppressing on all of those. My preference is press, suppress, knead. Press, suppress, knead. So let's go back to that UB24. So pressing. Press up and down the meridian. And this you don't want to rush, not even the demonstration do I want to rush. I could do a pressing technique starting at the top of the table, right? So just with my thumbs, my fingers. Still focusing on that local region. Good. And then I'll go into my suppressing technique. So for suppressing, the two main contact surfaces we're going to use are either our reinforced thumbs or our elbow. So with reinforced thumbs, I'll find that point. Make sure my body mechanics are good. Good. So it's a little easier for me in this case to have my fingers extended. So you tell me when we get up to a 7, all right? Big breath, good. And as you breathe out, I'll just increase the pressure. So it's quite strong stimulation, right? A 7 is right at that point where it's like, I don't really want you to go any deeper than that, but it's also not super painful. And when we're down to a 4, you can tell me. Just about. Press, press. And down to a 4, we'll do a little bit of kneading. Now the kneading's not necessary, it just feels good. Let's see how we use the elbow now, okay? So for the elbow, the same thing. We'll find that point with the olecranon, and you'll notice my whole forearm is in contact with the back. This hand is going to be doing the palpating, because I can't quite feel where that point is with my elbow. All right. I think I found it. Yep. So, forearm, first, whole forearm. Lean my body weight in, so the weight's coming from my core again. Notice my shoulder, it's not up here. Right. Really want to stack that shoulder. And then once I have the appropriate amount of pressure, which is really not much, I then bend my arm. How's that?
Oh yeah.
Oh yeah. So notice, I'm not putting any effort in at all. This is just my body weight. Okay?
Mm-hmm.
Yeah. Whole forearm is in contact. How does that feel? What number would you put that in?
Right now, nothing.
Nothing.
Fine.
Okay. Now watch the degree of my arm. And you tell me when we're at a 7.
There.
I did not change the pressure I'm putting in. I simply changed the contact surface. Making sense? And then of course when we're down to a 4, we go back into kneading. Then you'd be working bilaterally, of course. You work one side, other side, one side, other side. Let's go down into those hips and we'll do GB30. So finding GB30 again. Lateral third. Again, we can either use those reinforced thumbs or we can use our elbow. I'm going to use my elbow in this case. Find reinforced thumbs on the glutes. They're quite painful on your thumbs, so you either use a thumb saver or your elbow. So once I've got the location of that point, I'll just take my elbow in, the same thing. Rest my forearm, make sure my body joint, my body's stacked, my joints are stacked, and then I will bend that up. Will you tell me what? Yep, there we go. See how quick it is between having my elbow in extension and flexion. So you move very, very slowly. All right. One thing I want you to pay attention to when you are working on the glutes is if you do get a twitch, they tighten up, and you'll feel the glutes contract underneath the contact surface, elbow or thumbs or fingers, whatever it is. Back off. Like that's a sign you've done too much too quick. So you back off, you don't even bother going back into suppressing, you're going to those superficial techniques again. Basically means hit the reset button, start over, you went too quick. So that's pretty good reason to move slowly, because then you don't have to go back and restart, right? Suppressing, kneading, and then you do that a couple times. Now, how many times would you do pressing, suppressing? Yeah, it's kind of up to you. I tend to max out at 4. If I don't get that tissue to relax and I don't move chi through the point within 4-ish times, then there's something else going on. I've missed something. That joint is going to be tight, the muscles will be tight for a reason. I don't know what that reason is. So by the 4th time, if you're not getting results, move on. Move down now into those adjacent points. So it's UB36, UB37. So with UB36, in this case, I'll just use my knuckles and start to knead a little bit. How's that doing? Good. Okay. So the contact surfaces I'm going to use for pressing and suppressing here are either going to be the tips of my fingers or my elbow. So with the tips of my fingers, I'll just slowly work my way up. I'll push into that ischial tuberosity. How's that feeling? So far, so good. Good. I'm going to just do some pressing. And I'll do pressing down the UB meridian. And again, notice where the weight and the pressure is coming from. It's coming from my body, not my arms. All from my body. Okay, now I'm going to do my suppressing technique. Of course, do that more than one time through. Take your time, be patient. So, now that I've got the location of the point, I've got this thing called vector of force. The vector of force is essentially the direction in which you're pressing. I don't want to be pressing superior, and I don't want to be pressing anterior. I want to be pressing kind of superior and anterior. So I'm going to shift my mechanics, stand up, and press. You tell me when.
Yep.
Yeah. Now this technique works fine for me, right? Because I got these stumpy little farmer hands. I've got strong fingers. If you don't have strong fingers, this is not going to work. If your fingers hyperextend, it won't work. Like, look at my fingers, they don't hyperextend. That's just not the way they work. But yours might. So if you have, right, yeah, really your fingers hyperextend big time. So you would not use your fingers. Don't even try. You're going to hurt yourself. So how do we use our elbow? Stand facing the bottom of the table, rest the elbow, and then slowly work your elbow up into that ischial tuberosity. If you're having a hard time finding it, no problem. Just use your fingers, palpate, find it, replace your fingers with your elbow. And the same thing, full forearm is going to be on the posterior aspect of the legs. Increase my weight and pressure coming from the core, and then lift. How's that?
Yep.
Yep. And then we'd of course wait until we're down to a 4, and then we'll move into kneading. Yeah? Awesome. You never guess what we do down here on UB37. It's the same thing. You would have guessed it for sure. So, pressing. You can use the palm of my hand. You could use your knuckles. And suppressing. You can use our reinforced thumbs. You can use our fingertips. You can use our elbow. Whatever contact surface you want. You'll find that UB37, UB40, UB57 are very, very sensitive on most people, particularly if they have low back pain. So I'm just going to jump right into UB40 now because that takes a little bit more time to understand how to properly do it. So I'm just going to switch the sheets a little bit and undrape that leg, largely so I can bring the knee into flexion. So with the knee inflection, the main reason I'm doing this is it makes that point less painful. So I could certainly just jump into that point, do pressing, bit of kneading. You go slow in this point. Take as much time as necessary. Reinforce my thumbs, get my body weight up. Certainly I could do that, but let's take a look at how quickly we get a strong sensation. So let's use the tips of my fingers in this case. You tell me when enough's enough.
Oh, yeah.
Yeah, enough's enough. That's maybe the weight of 2 bananas. I don't know, is that a good metric? Pounds, tops. There's almost no pressure. So it's quite sensitive, but I haven't gone that deep. So what I can do is if I flex the knee and I do the same thing, I find those points. I can press in, get a little bit deeper. You okay?
Yeah.
And then we could do our kneading. Now you don't have to do do that, but it's a nice way to change the sensation. Kneading, pressing, suppressing. So of all of our distal points for low back pain, I would say UB40 is my favorite. It's, in my opinion, the most effective with low back pain. Now UB57, also very effective for low back pain, but UB57 is more effective for hip pain. So you can use this for hip and low back, primarily hip. UB40 is just low back. So let's work our way now down to UB57. I'm just going to push my way down. So I'm using or should I press my way down? So I'm using the palm of my hand, pressing down. And then once I get into UB57, I'll do some kneading. Do some static pressing with big, broad contact surface. You okay?
Yeah.
You're strong?
They're very tight.
Yeah, they are. Okay. And then I'll just take my thumbs, reinforced, stack my body mechanics, increase pressure slow. Yeah. Now, what made me stop this time wasn't that she said 7, it's that she went. So that big deep breath in and out, that means I messed up. I went too fast. That shouldn't happen. We shouldn't be pressing to the point where our clients are taking a big breath in. It happens when I'm doing a demonstration because I'm trying to go through it relatively quickly so you can actually get to practicing. But I really want you to go slow, and I don't want you to ever press to the point where your partner is tightening up, they're taking deep breaths, and I really emphasize that. If you are doing that, if you're pressing too hard, too quick, you're doing it wrong. That's incorrect. And if this were to be a final exam, I would dock you marks. So make sure that you are going slow. Take your time. Now, of course, if you do what I just did, it's not a big deal. It's not the end of the world, right? It's not like you've caused damage. It just means you need to refine your technique a little bit, slow down a little bit, and move in more easy. All right, getting the idea? So we've done our deeper techniques. That's our pressing and suppressing. And one thing we could do is on the lower legs. We could do some grasping techniques. I'll stand in horse stance. I'll just grasp the calf. You can do the medial bellies. You can do the lateral belly, right? The whole calf at the same time. You can do the same thing in the hamstrings, right? Grasp up the hamstrings. If your hands aren't big enough, no problem. Just don't do it. So as I do my deeper techniques, then I move back into my superficial techniques, which is largely going to be my pushing techniques. We could just knead nice and easy up the whole body. If you are working directly on the skin, this is a great time to do some scrubbing techniques. Remember, scrubbing is really making that heat. You have to do it directly on the skin though. So you scrub, get it really, really hot, and then get your herbal oil out after you've warmed up the skin with scrubbing. Get your herbal oil out, and then rub the herbal oil in. And afterwards, we have our finishing techniques, which are going to be our percussive techniques. So I'm going to do chopping, knocking, patting. So we're chopping, standing in a horse stance. What I want you to notice when I do chopping is the angle of my shoulders, elbows, and wrists stays about the same. So if I want to move to the other side of the body, I move my body. I'm not moving my arms. It's my body that's moving. Knocking. I don't really like to do chopping in the glutes, so I can do some knocking in the glutes. And padding. Cool, so far so good. That was a lot, but you get the idea, right? Superficial, deep, superficial. You've got your superficial techniques, fairly simple. It's going to be pushing, kneading. Get into our deeper techniques. Rolling, pressing, suppressing. We could do one finger meditation technique, which I didn't do. You could do one finger meditation technique. Go back in your superficial techniques. Scrubbing, rubbing, pushing, patting, knocking, right? So, cool. All right, give it a try.